why they're choosing Adderall over the Ritalin type drugs. And I think it's probably more of a concern if you have other risk factors for psychosis, for example, a family history of bipolar or a psychotic disorder. I might shy away from Adderall in patients with that kind of history.
So, Doctor, one of the things that I think is really interesting for a lot of people is, according to the Center for Disease Control, ADHD has been diagnosed at an increasing rate over the last 20 years. Now, if you talk to my grandparents, they'll say, there is no such thing as ADHD. It's just a kid who's not able to concentrate. All he needs is, go get me my belt,
right,
and I'll show you how to concentrate. And there are others who say, look, this has always existed. It's just that it wasn't diagnosed, 20, 30, 40 years ago.
Right. And if you actually go back in history, you can find very old examples of kids with ADHD. I think it is a real disease. I think it can be it can really impair people's lives, and these medications can have dramatic effects that can be very helpful. I do think that there is sort of a trend, especially in older people now, to kind of, or adolescents, to use them for other reasons than ADHD. Or, for example, I actually work at McLean Hospital, and I work on an inpatient unit for patients with psychotic disorders, which is why I started to do this research, because we were seeing a lot of college students coming in who were being prescribed Adderall with developing psychosis when they had no other psychiatric history. And so some people really do have ADHD, but then a lot of other students would tell me that they just were using it to get an edge. There's this perception that so many people in college are using Adderall that if you don't use it, you're kind of at a disadvantage, because people are using it to cram for tests, to stay up all night and study. And it does improve concentration, even if you don't have ADHD. If anyone takes a stimulant, they will actually be able to focus better, regardless of whether or not you have ADHD.
So your study, Doctor, focused on people who have been diagnosed with ADHD, though, not the people who are using it because they want to pass their tests.
We didn't study people who are getting it from their peers. We studied people who actually had a diagnosis and were prescribed the medication.
So, Doctor, I have another question for you, and I guess this is important for parents who are considering what to do with their children should they come across a situation like this. I was doing a story in La Crosse, Wisconsin, and I was profiling a little boy who had taken up crocheting. He was only about 10 years old, and he's become like this crochet phenomena. And he was showing his 5th grade class how to crochet, and one of the kids asked him if the crocheting helped him to focus. This was a little 5th grader asking another 5th grader if the crocheting helped him to focus. And what that little boy didn't know is up until he had taken up crocheting, he was considered one of the bad kids in school. And I asked the class if other kids had problems focusing, and they all raised their hands, and they started giving me examples of what they did to calm themselves down. One kid said they like to draw. Another kid said they like to play music. And I wonder if there are ways in this over-medicated society that we live in with children that may have ADHD, to focus their attentions by giving them some kind of I don't want to use the word hobby, but something that they do that will allow them to focus their mental energies as opposed to giving them medication.
Yeah, I mean, I think that's a great idea. And, medications are not the only option. There is behavioral therapy. I know that I've personally worked with people in the past who have thought they had ADHD, but they really just had bad time management skills. And so we kind of worked on how to manage your time better, and the person didn't really need to go on medication. So I think there's a lot of other strategies. There's behavioral therapy, but if you feel that the symptoms are severe enough that someone needs medication, there's a range of options. There's non-stimulants and the stimulants, which is the subject of this study.
Perfect. Dr. Moran, thank you so much.
Sure.
The ability to still control ADHD as a child at a school and containing a friendship. My story with ADHD, I was much more hyperactive when I was younger. I would get in trouble talking in class. I have lost a lot of things in my life. I also was very disorganized and suffers from stress. I also suffer from sleep issues, whether that is now or when I'm little. But is that due to the schizoaffective or ADHD? I can't really tell you that. Majority of staying up late is due to the schizoaffective, the 24-hour nights. Getting older, my problems begin to evolve into not being hyper, but still having a hard time paying attention. And when something happened, What happens sometimes is I miss out on stuff a lot in class. This is what I think experiences. This is what I think is the experience of ADD I have. I have a combo type symptoms, attention deficit disorder, hyperactivity, and may struggle with hyperactivity at times, but these are not my main characteristic. And multitasking. I have an antipsychotic, much like the videos talked about before. Antipsychotics don't go with medication. Combined type of ADHD is what I have. It was what I think I have. If that have any symptoms, you don't have exactly attention, behavior, instead a combination of symptoms, behaviors, categories, and exhibits. Most people without ADHD do a degree of behavior, but it's more severe in people with ADHD. The behavior occurs and intenses functions in a home, school, work, and in social situations. May have combined ADHD, combination of type ADHD. The National Mental Health is a type of situation. The type is more common in boys than compared to girls. Their most common symptoms children is ADHD. Symptoms of ADHD crop up between 3 to 6 years old and trusted average age is 7. Approximately 9.4% trusted of the children in the United States are diagnosed with ADHD. Through the ADHD, an estimated 4.4% of the adults are living with ADHD. Research trusted these numbers are the rise. Medications are available to help, but in my situation, as I said, an antipsychotic won't work. There was more of that at the beginning of this video. There are two types of ADHD medication, and stimulants and non-stimulant medication. However, that means that a psychotic issue can be acted as the same with the non-stimulant and stimulant medications. Stimulant is the most commonly prescribed ADHD, the fastest working ADHD. The chemicals and between 70 and 80% the trusted source. Children has fewer symptoms. Though stimulants do come with some side effects: anxiety, depression, appetite, headache, increased blood pressure, sleep, insomnia, stomach aches, all include psychotic issues. Some non-stimulants and medications are available ADHD. These can also help you focus attention, but they do not work as quickly. Non-stimulants is a good option for seeing improvements. Side effects: stimulants, adults with ADHD benefit from little children. It is important to work closely with your doctors and to determine best treatments help your ADHD. This is Sam Vaughn for Sam's Learning Disability Day and Sam's Mental Health Day. This is all the series in the playoff series are all wrapped up. Yesterday, the Rangers beat the Rays 7-1. That ends the Rays' playoff hopes. The Twins beat the Blue Jays 2-0. That ends the Blue Jays' hopes. The Diamondbacks beat the Brewers 5-2. That ends the Brewers' hopes. The Phillies beat the Marlins 7-1. That ends the Marlins' hopes. On Saturday, it will be the Texas Rangers versus the Baltimore Orioles. That game is set for Saturday. Houston and Twins. Houston to host. That game is set for Saturday at 3:45. Phillies and Braves. That game sets for 5 o'clock. Braves to host. Diamondbacks and Dodgers. Diamondbacks and Dodgers set for 8:20. On Thursday Night Football, the Washington Commanders and the Bears. It'll be Sam Howell and Justin Fields. Let's be honest, nobody cares about this game except the standalone game, and you may get some bets on it. But nobody would care if it was a Sunday game, and that would be it. Key position players DJ Moore and Terry McLaurin both have struggled this season. Some effect due to McLaurin has not has not had a good enough quarterback. Same goes for DJ Moore, who has struggled this season. Kick is at 720. That's your sports. This is Sam Vaughn for Sam Sports Report.